Are you wondering what's acid reflux? Well, stay tuned cause we're going to explain what acid reflux is. And 4 treatment options that are available to you. This video is brought to you by FindInfoWorld Networks, your resource for full-spectrum awareness about the things that matter to you. So, gastroesophageal reflux disease, or GERD. The medical term for acid reflux is defined as the abnormal reflux of gastric contents into the esophagus, which can cause mucosal damage. This disease strikes adults primarily, while infants and children can also be affected. Normally, it's spurred by eating certain foods, pregnancy, or going to sleep right after eating a heavy meal. A large number of people suffer from acid reflux at one time or another. Heartburn or acid indigestion is another name that refers to acid reflux. Heartburn, the major symptom of acid reflux in the esophagus, is described as a burning or uneasiness at the back of the breastbone. The symptoms may come as coughing, voice transformation, hoarseness, constant earache, or sinusitis. The complications brought upon by acid reflux may lead to esophageal ulcers or worse, to esophageal cancer. However, constant heartburn sensations do not necessarily mean that one has GERD. When heartburn happens more than once a week, this could possibly lead to developing GERD. The usual cause of GERD is the increase in acidity or gastric acid production in the body, obesity, pregnancy, or tight-fitting clothes. These all can add to the problem. A yeast infection, or candida overgrowth, is also thought to be one of the causes of GERD-like symptoms. An added ironic cause of GERD is the insufficient production of stomach acid. This results in inefficient digestion, and when the valve between the stomach and the esophagus, known as the lower esophageal sphincter, does not close properly, contents in the stomach flow back into the esophagus. There are several treatments for GERD today, one of which is a balanced diet and healthy eating habits. Now, if proper diet and nutrition fails to work, one can shift to medication or surgery as suggested by your doctor. Below are 4 forms of acid reflux treatment. Number 1. Proper diet. The natural way to treat acid reflux is through change in eating habits. A good number of people affected by GERD found success in following this method. Avoid food ingredients which can intensify heartburn, such as caffeine, soft drinks, and smoking. Avoid eating 2 hours before sleeping. Likewise, avoid lying down after eating a meal. These previously mentioned things are the suggested changes to lifestyle. Number 2. An easy way to treat GERD is to elevate the head of the bed. This pharmacologic therapy, the combination of not eating food 2 hours before sleeping and the rise of the head of the bed, there is a great chance to get 95% relief of symptoms. The rise of the head of the bed is suggested to be in the range of 6 to 8 inches or 20 centimeters. Using this method can cause the backflow of gastric fluids to be reduced or eliminated. Number 3. Drug treatment. Drugs can reduce the secretion of the gastric acid. For instance, famotidine and omeprazole lessen the secretion of gastric acid, while antacids counteract the acid. Number 4. Surgical treatment. The Nissen fundoplication, the standard surgical treatment for acid reflux. This medical procedure is a minimally invasive fix to the problem. The function of this is to support the sphincter, a spherical bond of muscles that opens and closes to let the food or whatever you're ingesting pass, as well as stop acid reflux, and of course repair the hiatal hernia. Did this help you? If so, please share this video with someone who would benefit from this information. By the way, would you like to discover how a former severe acid reflux sufferer used the only holistic system in existence to permanently reverse his acid reflux and achieve lasting freedom from most digestive disorders and regain his natural inner balance with a unique 5-step method? No one else will tell you about this. Click the number 1 recommended link in the description box below to check it out and see for yourself. Please like this video and subscribe to keep getting helpful information like this. Before we end here, we should also inform you that this video is for informational purposes only, and is not intended to replace or substitute any advice from your medical practitioner, a qualified doctor, or any other health professional and advisor. You should consult a qualified health practitioner before implementing any of the suggestions found in this video or our recommended resources. You should not give up any medical treatment you're currently using without the express consent of a medical professional. Thank you for watching. Stay tuned to the FindInfoWorld channel for more videos like this. See you soon.